Good afternoon, everyone. Welcome to the weekly webinar. Glad to see all of you here. And I'm going to make just a couple of announcements, which are our usuals. It looks like most of you are muted. Thanks for doing that so we don't have any interference while our speaker presents. If you need closed captioning, you should be able to click on the More icon at the bottom of your screen, and you'll see an option for closed captioning. If during our time together you'd like to ask a question or leave a comment in the chat, feel free to do that. And we are recording, so this will be available for future watching or rewatching later tonight, probably. So with that said, I'm very happy to welcome Dr. Heather Wilkins to the webinar. Some of you may remember that we originally had planned to have this presentation about Alzheimer's disease and metformin in April of this year, and our speaker was not available. And so Dr. Wilkins came through in the clutch to give us some information for today. So I know a lot of you have been wondering, when are we going to get this back on the calendar? And today is the day. So with that said, I'll tell you a little bit about Dr. Wilkins. She has a degree in microbiology. She's faculty at KU Medical Center, and she focuses on how brain energy influences Alzheimer's disease pathology. And one of my favorite lines from her bio is that she works on mini brains in a dish. Which, I mean, if that isn't an image, I don't know what is. So we are super lucky to have Dr. Wilkins today. And so I'm going to turn it over to her. Thank you very much, Dr. Wilkins, for sharing your time today. And I know we're all excited to hear about metformin. So all yours.
Yeah. So I was just gonna, talk generally about metformin and what it is and kind of ongoing studies and what studies suggest so far. I know we had one question that was sent in, so I'm going to answer that question and then obviously answer any further questions. And you can hear me, I assume. So, okay, good.
Perfect.
Great. I was trying to get my displays fixed because sometimes they get a little weird. There we go. So what is metformin? Well, it's a pill that you can take. It's generally prescribed for insulin resistance, and or type 2 diabetes. It's also called glucophage. So it has a couple of different names. And it was first discovered in 1922, but the first human study was in 1950. It did not receive FDA approval until 1994. It was actually approved in the UK before it was approved in the US for use. Like I said, largely it's prescribed to people who either are pre-diabetic or have type 2 diabetes. Sometimes it's used in type 1 diabetes as well. And it's also used sometimes in fertility treatments for people who have polycystic ovarian syndrome, because it can help reduce insulin resistance, which is seen in that disease as well. But what does it do? Which is always a great question. And I'll say that these are the main actions, but there's still a lot we don't know about the way that this medication works. So in general, your liver makes glucose, which is really important because, for example, when you're not eating food, your body still needs sugar and energy. And so the way that it gets that is from your liver. Your liver generally will make glucose as your blood sugar starts to drop, which would happen during a time of fasting or even during exercise as well. And it's really important for it to help maintain your blood glucose. The glucose is released into the blood, from your liver, again, to increase your blood sugar during times that you might have a lower blood sugar. And this is really important physiologically, as I said, but this can also be unregulated in people who have diabetes. if your blood sugar is already really high, then you don't want your liver putting more glucose into your bloodstream. So what metformin, its main mechanism of action is it reduces the amount of glucose that the liver makes and releases. And so essentially, this can help lower blood sugar, and it can also help increase the action of insulin because there's not as much glucose in the blood that insulin has to deal with. So I'll also take a step back and talk about why does our body produce insulin. So insulin is produced in your pancreas. It releases it. It is released after you eat a meal or ingest something that's going to break down and make sugar, and put sugar into your blood or glucose. And what this does is it's kind of acts like a key, so that the different cells in your body can take up the glucose or sugar and use it for energy. So kind of like unlocks the door so that it can get into your cells. And so this is really important because if you have a really high blood sugar, your pancreas should produce more insulin. And this should allow that sugar or glucose to get into your cells. However, in diabetes, you have insulin resistance. And so you're producing a lot of insulin, but it's not getting into your cells as effectively. And the mechanism of that is not well known. But reducing the amount of sugar in the blood, really helps increase the action of the insulin that you are producing. Metformin may also reduce appetite. There are some studies suggest that it can reduce the amount of food intake in people. So this can be important in Alzheimer's disease, because as I'm sure a lot of you know and have heard, Alzheimer's disease be called type 3 diabetes. Insulin resistance is found in 80% of people who have Alzheimer's disease. They have insulin resistance or type 2 diabetes. There is reduced glucose uptake into the brain in individuals who have Alzheimer's disease. This image here is actually called a fluorodeoxyglucose positron emission tomography scan, or an FDG PET scan. Some of you may have had them, for research purposes or diagnostic purposes. But the more red that you see is higher glucose uptake into the brain. So this is someone with normal aging, and this is someone with late onset Alzheimer's disease. So you can see that there's a lot less red in Alzheimer's disease. So for some reason, the brain is not taking up glucose. And like I said, insulin is required for most cells to take up that glucose. It acts like a key. And so there have been a lot of studies and hypotheses suggesting that there's brain insulin resistance in Alzheimer's disease. So that really brings, up a question of how do we combat this? And could metformin be something used to do that? Now, it's important to talk about the other effects of metformin in other studies. Not all studies have been done in humans. Some have been done in, animal studies. But we do know that it extends a lifespan in numerous species, all the way from studies in lab models that are called C. elegans, which are little worms, and even lab models that are little flies, Drosophila, and mouse studies. And so, that's really interesting because animals that are taking this drug live longer. It also might reduce mortality rates in humans. There are some epidemiological studies to suggest that people who are taking metformin live longer. And it also might reduce cancer rates in humans. But again, these are epidemiological studies, and they have not been further studied in really controlled, randomized clinical trials yet. There's also something to think about, though, when we think about increasing the lifespan. It's really important to understand, though, we don't just want to increase lifespan, we want to increase what's called health span. And so usually, there's normal aging, but eventually, during aging, we get age-related diseases. Our goal here when we increase lifespan is to, not only increase the amount of time that someone is living, but also increase the amount of time that they're healthy. Because ideally we don't want to just increase the amount of time someone is living, and has added disease burden. We want to be able to make sure that people are living longer, healthier lives. And metformin is something that's being actively studied for that. There are a lot of studies of metformin and Alzheimer's disease and dementia. The thing, though, here is that a lot of retrospective studies do not agree. There are some studies that suggest there's reduced risk of Alzheimer's disease with metformin use. It's been shown that people who were taking metformin and then stopped taking metformin had an increased risk of Alzheimer's disease by about 20%. There are other larger studies to suggest that there's a reduced risk of Alzheimer's disease in those with diabetes that take metformin. However, other medications could alter this outcome, such as antidepressants and non-steroidal anti-inflammatory drugs like ibuprofen, for example. There are also some studies that suggest metformin might increase the risk of Alzheimer's disease. However, there are some, other factors that need to be taken into account when looking at these studies. One of them is that their long-term use of metformin can reduce the amount of vitamin B12 that someone has in their blood, and vitamin B12 deficiency in and of itself can cause memory loss and dementia type symptoms. And so this is something that needs to be monitored when someone is using metformin, because it's very easy to replace vitamin B12 with just, an oral vitamin every day. But this is important, and could, be a confounding thing in some studies. Um, Studies that were looking at, brain samples postmortem of people who took metformin, showed that metformin had no effect on the AD pathological burden or strokes that were found in the brain. And then there are some studies that suggest metformin use must, I should say, begin before onset of cognitive decline. So this is really important, and it's going to be good to know because that is a big question in a lot of therapies is can we start, potential therapies after the onset of cognitive decline, or should we really be starting them before in people who are at high risk? And there are, like I said, are studies that show early use of metformin, can improve cognition, and also imaging and cerebral spinal fluid biomarkers of Alzheimer's disease. But that's not always observed when metformin is started after cognitive decline begins. So I was just going to highlight some of the ongoing studies on metformin. And I was going to point out, you can search clinical trials that are ongoing at the site called clinicaltrials.gov. And it lists pretty much any, all clinical trials that are at least have been, registered with that website. But this is a big one that's happening in the US. It's called Metformin and Alzheimer's Dementia Prevention, or MAP. It began in 2021 and it ends in 2027. They're enrolling people who have mild cognitive impairment, and it's a double-blind placebo-controlled trial. So what that means is that the practitioners don't know who's getting drug and who's getting placebo, and neither do the people who are in the study. It's a phase 2 and phase 3 study, which means it's looking at safety and some markers of whether it's effective at preventing dementia. As I said, you can read more about it if you want on clinicaltrials.gov. This is the identifier for it, so it's easier to find. And this is US based. There are 2 non-US based studies going on. One's called MEMORY. It began in 2022 and ends in 2027, and it's happening in Australia. And then there's one based in Finland, Sweden, and the UK. And that began in 2023 and ends in 2026, but it's called the Finger 2.0 study. And what's interesting in this study is it's not just metformin, but they're also looking at lifestyle changes as well, in addition to metformin. Okay, So we had one question ahead of time from the audience about a supplement called berberine. And so what's interesting to know about this supplement is that, yeah, it might reduce blood sugar levels, but it's not well known how it works. And studies are ongoing, looking at its potential to reduce cardiovascular risk. However, it is important to note that it can negatively interact with some medications. So you need to talk to a physician, and who can look at your current medication list to see if it's okay for them to be used with berberine, because you don't want other medications to be, you know, hanging out in your blood for longer and causing negative interactions because you're taking berberine. And the other thing that's important to note is supplements are not FDA regulated. And so from there, it's not guaranteed that the products that you buy will contain berberine in it. And for that reason, just make sure that if it's a supplement you're taking, that you're talking to your physician about it, and you're making sure that you are purchasing it from, a reputable supplier. Those are always things that are important to consider anytime you're taking over the counter, vitamins and supplements, and things of that nature, because it's not guaranteed that, what they say is in that pill is actually what is in that pill. And we hope it's nothing dangerous, that they might be putting in there. So yeah, so that's all I really had, in my presentation. And I wanted to make sure that there was some time to answer any questions from the audience. I know there was a lot of people wanting to hear about metformin, so please feel free to ask questions.
Thank you, Dr. Wilkins. Yes, everyone, please unmute yourselves at this point if you like, and or use the chat. I have a question that didn't come from a My Alliance subscriber, but it's something I've heard about probably over the last several years, and that is about the link between diabetes and future risk of Alzheimer's disease, and it's sort of become, I don't know, dare I say, trendy among some groups to say that diabetes or that Alzheimer's disease is diabetes type 3. Can you address that?
Yeah, so there is a risk, with both type 1 and type 2 diabetes, of dementia or cognitive decline with age. Whether or not, that winds up being Alzheimer's disease isn't a question that we can really answer until, postmortem, because that's how it's definitively diagnosed. But
Right.
there is an increased risk. And so that's why we always give the advice of making sure that you're keeping, track of your blood sugar and your blood pressure and your cholesterol and all of those things that are going to help you lead, a healthier and longer life. It's something that's being actively studied. Here at KU, we've had a few studies looking at things like intranasal insulin, and other types of, lifestyle interventions that not only target, type 2 diabetes and insulin resistance, but also brain health, because those go hand in hand.
Okay,
We've
good.
got a
Good.
few
Yes.
questions.
Good questions in the chat, Dr. Wilkins. I'll let you, if you can see those, I'll let you
I
go ahead
can,
and
yeah.
pick and choose
Um,
as you would like.
So the first question, from Catherine is KU a part of any study on metformin? Not currently. There's only one clinical trial ongoing in the US, that MAP study, and we are not, a part of that study. We're not a site. But you can go onto clinicaltrials.gov and see, where the sites are, if you're interested in it. Sometimes they'll have, other satellite sites that we may not be aware of, if it's something you're interested in. But yes, not currently. Jan is asking, I am a recovered diabetic, diet and exercise having had a positive effect. I'm happy to be able to go off the metformin, but now I'm thinking I should have stayed on it. If so, what dosage is ideal? So for that, I can't give advice on dosage. That would really be up to your doctor. And I think this is definitely a really good question to talk to your primary care provider about, on if it's a good idea to stay on metformin, or could discontinue it. Because whether or not someone should be on a medication is pretty complex based on your other health history that I don't have access to. So I would definitely speak to your doctor about that. And Beth is asking, what are the pre-diabetes symptoms or lab test results? So pre-diabetes symptoms can range, from feeling tired, thirsty, using the restroom a lot, irritability, things like that. If you're getting your regular checkups with your primary care provider and having, your physical done, you're also getting lab work done. And that may include a fasting blood glucose level. And usually if a fasting blood glucose level is above, I think it's like 100 to 110, or even up to 120 might be pre-diabetic, and anything above 120 is diabetic. And so the next thing they could check is another lab test called a hemoglobin A1C. And what that looks at is how much of your hemoglobin is acetylated, and that is a surrogate of your average blood sugar over the last 3 months. A normal hemoglobin A1C is below 5.8. And if it's higher than that, then that suggests that you've had elevated blood sugars for a period of time of at least 3 months. And so that's usually one of the first line medications they start people on is metformin. And so that might be the first thing that they start you on. They may start you on other classes of medications as well, depending upon, how high blood sugars are and how high your A1C is. So Arnie is asking, what are the downsides of metformin? Well, so I just full disclosure, I actually take metformin because I'm type 1 diabetic. And I can tell you that it does have some GI side effects, which can be frustrating. So usually you'll start out on a lower dose and then work your way up to a dose that's therapeutic for you. Metformin comes in many different formularies. There's regular metformin, and there's what's called metformin extended release. So it just releases more slowly and it sticks around in your body a little bit longer. And that metformin extended release is sometimes tolerated better by individuals. But I will say that once you stay on a lower dose for a bit of time and get it up to the higher dose, then that can kind of help mitigate some of those GI issues. And as I said, the other downside is vitamin B12 deficiency. And so long-term use of metformin, you might have to start taking vitamin B12. But as far as that, it's largely a safe drug. And you know, it's it's widely used. Okay, so Beth is asking, does this drug help high triglycerides? I have metabolic syndrome. So it can. Basically, once you get your blood sugars down, usually you'll notice that your triglycerides will also normalize, but it doesn't always. So if you have high cholesterol, in addition to high triglycerides, you may need other forms of medication like a statin, but that would be a good question to ask your primary care physician. And then Tom is asking, what dosages are being explored in these studies? I have been on 500 milligram tablet twice daily for 8 years for prediabetes. So you are actually on the max dose of metformin. The highest dose that's ever given is 2,000 milligrams per day or 2 grams per day. And it sounds like that's what you're taking. If you're taking 1,000 milligrams, or you're on 5,000 milligram tablet twice daily, so you're on 1,000 milligrams. So 2,000 is the highest. But again, sometimes those higher doses do have those negative GI side effects. So it's something you want to think about. But 2,000 milligrams per day is the highest dose that's being studied currently. So, yeah.
Wow, thanks everybody. Those were some really great questions. Oh, Beth's got another one.
Does the metformin study disqualify me in the ADNI 4? I actually don't know. That's a good question. I would assume not, especially if the metformin study. Well, we don't have an ongoing metformin study, but I think if you were to enroll, since it's a clinical trial, it really depends on if ADNI 4 is allowing people who are in clinical trials to be in their study. So that would be, I would check with, the clinical coordinator on their exclusion and inclusion criteria, because I'm not familiar with those. But there are some studies that if you do other clinical trials, you can't be in, just because we don't know the effects that those drugs may have on what they're looking at.
Okay. Beth, I just put a note in the chat, and this goes for anybody. If you want to know the answer, I don't know without looking,
Yeah,
but that's
I'd have to
something I
look at
can
the
find out.
exclusion inclusion criteria. I'm not
Yeah.
sure. Yeah.
So Beth or anyone, if you want to send an email to My Alliance at kumc.edu, we can find out. And thanks to Jeff for saying, looks like it might be possible.
So I want to take a caution and say there's a difference between a clinical trial. So, for example, if you were enrolled in a metformin clinical trial, that is very different from just taking metformin that is prescribed by your doctor. So, for example, if you've been on metformin for a stable amount of time, usually most studies will say 30 days stable medication use, then that's usually fine for you to be in studies, for example. But in a clinical trial, it's different because they don't know if you're on placebo or if you're on the drug. And so that's really hard. Everyone's blinded. And so that's really hard. So it's different between taking metformin that's prescribed by your doctor versus being in a clinical trial for metformin. So, and is the MAP study only for those with mild cognitive impairment? Yes, the answer to that is yes. Are there any other medications similar to metformin being studied currently in regards to Alzheimer's disease? So yes and no. There are, things like intranasal insulin. There are other insulin sensitizers that have been studied. KU just finished their clinical trial on dapagliflozin, which is an anti-diabetic medication. It just has a different, way that it works. And I know there are some studies ramping up with the newer, like Ozempic and Mounjaro type drugs. So the GLP, GIP, agonists. So there are studies that are looking at other drugs that are used for diabetes and Alzheimer's disease. Okay, so Alan is asking, I have been taking metformin for 25 years and I'm 82. You took a CSF fluid sample 5 years ago. Would it be relevant to look at that sample? Yeah, I mean, so we do look at them when we take the samples. They're not just stored. We do measure things in them. It's just dependent upon the study you're in, you may not get the results given back to you. Largely because some of the measures that are done are not FDA approved, and we don't want them to wind back up in your medical record. But I do know that we are starting studies where, as we take fluid from people, if they would like to know the results, then we will have a physician review the results with you. So, but sometimes it can take up to a year for us to get all of the results completed. So.
All right. Wow. Great energy. Obviously, lots of energy around this topic. So thank you, Dr. Wilkins, for sharing your personal and professional expertise. I am excited to tell you that Dr. Wilkins has agreed to come back next month and talk about biomarkers in Alzheimer's disease. And I believe that's on July 18th. So it'll be in an upcoming issue of the My Alliance newsletter. You'll get more information about that. So you can be thinking about joining us for that day and hearing about biomarkers, which are especially interesting to us because of newly approved treatment for Alzheimer's disease. Some of you may be familiar with Leqembi and donanemab, I think it is, that are drugs that are looking at biomarkers in the brain, which is a bit of a shift from earlier drugs for treating Alzheimer's disease. So stay tuned. July 18th will be here before you know it. And we'll have Dr. Wilkins back to talk to us about that. Next week is the 4th of July. And so we will not be meeting for the weekly webinar. You can be independent of the weekly webinar this time next Thursday. We will miss you. What we will have in the upcoming issue of My Alliance is a list of webinars you might want to go back and rewatch or watch if you missed them the first time. So there will be a list of those, and we'll include a link to our playlist of all of our webinars. So if there's one that you really want to see that you didn't get to see before, you'll have access to it. So watch your My Alliance newsletter on Monday. That'll be out at 7 o'clock Central Time, as always. And then we will return on Thursday, July 11th. And the topic for that day will be a sneak peek of our upcoming family series, which I'm going to be hosting at the Kansas City, Missouri Public Library, the downtown branch, which is the one with the big garage and the books. Really cool. That will be available in person and as a hybrid. So if you can get on Zoom like you do for the webinar, you can get on Zoom like you do for the family series. I will do a shameless plug and say I think it's better if you come in person because I like to see you in person. And we will have snacks if you come in person. If you come on Zoom, you will not have snacks. I'm sorry, I just don't have the capacity for that. But if you come in person, we will have snacks, and we will have, even more importantly, information about tips for caregivers. We will be recording it, and we will be meeting every Wednesday from 4 to 5:30 starting July 17th. So we'll talk a bit about that on July 11th, and then Dr. Wilkins will be back with us on the 18th. And then I'm not going to tell you anymore because I like to keep you in suspense, but we have some great topics coming up for July and August. So with that said, 2:30, Dr. Wilkins, you win the award recently for staying on task and winding us up right at 2:30. Now it's 2:31, but that's my fault. So thank you, everyone. And I hope you have a great rest of today and a great holiday next Thursday. And we'll see you back on July 11th. Take care. Bye-bye.